hold them to higher standards of responsibility, and begin to promote greater involvement and greater participation in a way that can bring about changes in this area. Now, we've been, doing a lot of stuff over the last 15 years, of course, as Rico said, but, we don't claim to have the answers. I think the answer really rests with each one of us. And so hopefully tonight, we can begin a discussion that will lead to some kind of plan to begin addressing what our concerns are, and or at least identifying our concerns and coming up with a plan on how we're going to address these concerns in a way that will make things better. But we, each one of us, have a responsibility as a citizen, and as a taxpayer. We have responsibilities and we have duties. And I think we got to step up to the plate and stop looking outside for somebody to come in here and do for us what we're supposed to be doing for ourselves, and start talking more to each other and connecting with each other, in relationships, so that we can, have a community again. And I think our children deserve this. And so I just wanted to throw that out. So
at this time, anyone that would like to have anything they would like to say? Lois,
I have two questions. My first question is, I've seen the building Westside Park Authority for years. I always thought it was a health-related facility. What exactly is it? That's my first question.
Okay. Well, I guess I can answer that.
Right.
Westside Health Authority is a 501c3 community-based organization. We're a non-profit organization. We've been around for about the last 18 to 20 years in the Austin community. The Westside Health Authority was organized in response, back in the late 80s, in response to the changing or reforms in healthcare, when hospitals began to change the way they operate, and they began to decrease the number of beds, and there was more of an emphasis on out-care patient and in-care patient, and we saw a breakdown in the relationship between doctors and patients. As a patient, you could no longer, really choose your own doctor, and the doctor could no longer practice medicine with you the way that they had traditionally done. And so the whole healthcare industry was going through some reform. And the reform brought in what is now known as HMOs, or health maintenance organizations. And these health maintenance organizations took the power away from doctors, and made healthcare become more of a profit-driven industry than one that was about trying to heal people and bring about wellness. And